Now here are the organs of the urinary system, and the anatomy is very easy in terms of like the urinary system, and at least at this level. So again, we have our kidneys. These are the ones that filter the blood and then make it form urine. Then you have ureters that carry urine from the kidneys into the urinary bladder and then out through the urethra. And men and women, or males and females, have urethra. All right, and then kidneys. So where are the kidneys located? Well, let's think about practical. So where can't you punch or box in, or where can't you punch in boxing or in MMA? Several places you can't punch, and you cannot punch your opponent's back. You can't punch the back of their head because, again, remember you have your medulla oblongata and your brainstem back there controlling all those vital functions. You also can't do a kidney punch. Just usually disqualifies you. And why is that? Why can't you punch there? And I should also include below the belt, but why can't you, in terms of above the belt, where can't you punch? You can't punch all of these locations. And if you look at the locations of the kidneys, now we're looking at the back of the body. So notice that the kidneys are located here. Here we have our 11th and 12th ribs, so the bottom of our rib cage. Notice that the kidneys, there's this part where it's not really protected compared to the other organs in your body. So the left and right kidney, they are kind of exposed here. Here we have our hip bone right here and our pelvic girdle, and here we have the bottom of our rib cage. So this is pretty much just muscle and flesh. And if you look at a cross section right here, so you do have all this muscle over here and in front. So say someone gets a punch to the abdomen, well, again, you have all the abdominal muscles as well, it's kind of forming a barrier. But look at what happens if someone gets a punch to the kidneys. Well, notice that they're pretty close to this area over here, and they don't have bony protection from the pelvic girdle or rib cage as well. So this is why you don't want to have trauma to the kidneys, and that's why I think in most regulations they would forbid punches to the kidneys in boxing and MMA. All right, so that's where the kidneys, and now this is looking at the abdominal cavity. And what do we notice? Well, there's a lot going on here, but I'll walk you through it. So what happens here is that we have our diaphragm and also other muscles. Now, do I expect you to know these muscles? Yeah, I assume you already knew these from PHYL 141. But what I'm showing here is that in the back of this abdominal cavity, you have a wall of muscle, among other things. But the thing is that if you've taken the lab or seen or if you've seen the field pig dissection in lab, notice that you can't, when you open up here from the front side of the body, you're not going to immediately see the kidneys. You typically have all of this in front. So again, if you open someone from the ventral side, you're not going to see it immediately. You have all of these organs weighing there right below the skin, right? And muscles and abdominal muscles. And what we have here is all the liver and our GI tract and alimentary canal. And if you remove these, then you also will encounter another sheet. And this membrane is called a peritoneum. So the kidneys are located what we call retroperitoneal. So the peritoneum is a membrane, and the kidneys are located behind this peritoneum. This is why we call it retroperitoneal, and between that muscular layer in the back of the abdominal cavity. So this is why to actually see the kidneys itself, you have to cut past the sheet of peritoneum and then finally get to the kidneys over here. So again, retroperitoneal is an important term referring to the location of the kidneys behind the sheet of membrane. And again, we have our adrenal glands sitting on top of our kidneys, and then our ureters. And so the peritoneum, even though I showed it as a simple sheet in that previous picture, it's actually kind of complicated. Like especially your large intestines actually weaves in and out of the peritoneum. So sometimes in certain sections like the transverse and sigmoid, it's actually in front of the peritoneum, and then the ones like ascending and descending colon, it's actually in the back. That's a little bit advanced. I don't expect you to know like, okay, all of this laundry list are over here. If you're going to advanced A&P or planning on going to med school, or I'm pretty sure like maybe nursing would actually, the NCLEX might have this as well. It might be good to study ahead, but for this class, definitely know the kidneys are retroperitoneal. All right, so then look at the left and right kidney. So often when you see anatomical pictures, you know who's just being an artist versus who actually has taken anatomy, because notice that the left and right kidney, they're not quite flush with each other. So if you draw a line, you notice that the left kidney and right kidney, they're not at the same level. There is some sort of offset vertically. So the kidneys are not at the same horizontal level. The left kidney is actually slightly superior to the right kidney. And why is that? Well, remember, how do the organs fit in the body? Hey, there's this big organ, and is this big organ that's super duper important? It's completely symmetrical between its left and right side. So again, the right lobe of the liver is larger, has more mass, so it's going to displace the right kidney. So this is why the right kidney is, in most people, is at a lower level, because again, the right lobe is typically larger in most people. All right, so then left and right kidney, they're again retroperitoneal, they're not the same horizontal level. So what do? They help filter blood and maintain homeostasis in your blood. So you have your renal arteries, again, arteries carrying blood away from your heart. They're going to supply your kidneys with this oxygenated blood. And then your kidneys are going to form urine, and then the blood is going to return from the kidneys via the veins and up through the inferior vena cava. So what about this urine that filtrate we've eventually converted to urine? Well, that's going to go out from the kidneys through the ureters and then into our bladder.